Sexual health is a specialist area of nursing, and it will require nurses to develop skills and knowledge in contraception and sexual health. But already a nurse will have a basis, a foundation of transferable skills.
So I worked for around 8 years as a midwife. I branched out of working on the labour ward to working within integrated sexual health services then.
I started in gynaecology. I did that for about 1.5 years and then came here and then started specialising with the young people in the outreach.
I was doing sexual health already in South Africa. The South African sexual health situation is quite dire. Therefore, we already came in a knowledgeable way.
It's always a subject that interests me, and I think education around children these days in general is just something that I just feel quite passionate about, really.
The thing that drew me to sexual health was the fact that it was about talking. It's not like working, in ITU with lots of bleep machines and stuff. It's about communication and that human aspect. And I didn't think I was going to stay forever. I thought I was only going to stay for a year. But it really sort of has resonance with me in terms of my personality and what I really enjoy.
I think you've got to come into it knowing that there is a lot to learn. To be able to provide that level of service, you need to have that knowledge.
There's quite a lot of work that goes into it, but it's interesting and you're definitely learning. Your brain's like a sponge, it just soaks everything up, and you've just got to find a little compartment in there to just put everything into for when you're going to need it in the future.
I didn't feel I was academic enough to go straight into uni when I'd been out of uni for so many years, and this course was a step to getting into my nursing degree.
I always studied in relation to the job that I was doing, and I always wanted to have the tools to do the job competently and confidently.
People, when they come, often feel quite stigmatised or embarrassed, and so getting people to feel comfortable about that as much as they can, I really enjoy.
One of my missions in life is really to be able to talk about sexual health matters as freely as we talk about having a sprain or broken leg.
So with my outreach, I really enjoy being very autonomous on my job role. I get to talk to the young person. We get to build that special bond with them and just make everything a lot more comfortable for them.
My role as the consultant nurse is around training and developing other people, as well as being a clinician, and I love developing other people.
I can look holistically at a woman's health needs, and we can provide counselling, support, as well as look at their sexual health, and maybe offer screening or health promotion or treatment. It's having all those training opportunities and being able to deliver such a variety of care to one woman.
For somebody coming into the service, I would say utilise all the experience that you've had as a nurse to the max, because every little bit helps. We've all come from massively different backgrounds and we all bounce off each other. What I'm most proud of, I think, is becoming a dual qualified sexual health nurse and being able to provide that service for people.
Seeing a patient come into the clinic very nervous, and for that patient then to leave feeling relaxed, informed and reassured is a very nice thing to do. It's a nice feeling to have.